Hello and welcome everyone to our second webinar for VR patients. We're going to take a few minutes and let everyone start to gather in and collect in the waiting room and our attendees. We see we have 10 attendees already today. This is the immersive education, practical steps to integrating VR patient simulations across your curriculum, EMS and nursing. We're here to talk through some practical steps for you. And we've brought our expert along. So we're just going to take a minute, let people come in for a few seconds. Feel free to put in the chat where you're from. We'd love to hear from you. See if anyone is in the Ohio area where I am. Martha is in the Colorado area. And we got a couple of our friendly internal producers on the back end, and they're also in Colorado and Indiana. So put in the chat where you're from, and we'd love to see what part of the country is joining us at today's webinar. Again, this is the Immersive Education and Integration for VR Patients webinar, and we're going to talk a lot about the foundations of integration, the learning experiences, how to boost your engagement, building essential skills, and let people start to roll in. Welcome, Nick from New Hampshire, Battle Creek, Michigan. I got to say, Clark, that is a really cool name of a town to live in. I'm in Mason, Ohio, which is in Cincinnati. Where are you at, Martha?
I'm in Thornton, Colorado, which is
That's also a good name for a town.
Yeah, northeast of Denver.
I feel like Thornton, Colorado is the place where authors live, and there's lots of writing happening by creeks and the wandering brooks.
Yeah, but sometimes the locals pronounce it Thornton, which makes me giggle just a little bit. I don't know. I think Laconia is interesting, Nick.
Yeah.
Interesting sounding town.
And welcome, San Francisco.
Yeah. We have several Michiganders.
Yeah. Martin in Tennessee. Oh, you're only 4 hours away. Welcome. Coldwater, Michigan, another cool name for a town. And also apropos, Coldwater in Michigan.
They do know about that.
Oh, man, we got friends. Oh, shoot. We got friends in the room. Oh, we have a special guest joining us right now for the webinar. Thanks for your support, Dwayne Ginder. I'm sure you know the man who helps you all solve problems and onboard and build stuff. So Dwayne just joined us. Potatoes are here from Boise, Idaho. Nice to see you, Justin. We're glad to have you. Again, this is the Immersive Education and Integration webinar with VR Patients. We're going to talk today about actionable strategies and scaffolding in VR simulations throughout your entire program. So I hope you've brought your pens and pencils. Send this along to your colleagues and flag them down to sit next to you. This is going to be a hoot and a holler. You know, while we're sitting here waiting, I think we're just going to give it one more minute while everyone else joins. We have a good amount of people coming in, a nice percentage of our invites. This is our second webinar that we've done for VR patients, and we're really excited to continue to do these as we, maybe quarterly or maybe even more than that. Maybe we'll get to a place where we do them monthly for you all. Please expect a feedback survey after this webinar because we want your information about how this went, what you would like to see next time. We sent out a survey last time and we got some great feedback from you, which informed what this webinar was going to be. And we want to make sure that these are actionable and helpful for you guys. All right. We should probably get started. It is now 4 minutes past the hour. I'm going to take a minute to introduce you to Martha Levine, our Director of Innovation and Integration. And with that, I'm going to close my mouth and toss the mic. Martha, the show is yours.
Devin, you're the best. So my name's Martha. I am by trade a nurse and nurse educator. I've taught in a variety of nursing education programs from the community college level all the way through graduate school. I've also taught in the clinical setting as a director of a nurse residency program. So I'm familiar with both. And one of my proudest things that I accomplished was really developing a simulation program and an interprofessional simulation education program between several different disciplines in the healthcare at the local community college. I really enjoyed working with the paramedic students and educators. I feel like that collaboration is really important. And so I'm thrilled to be here to talk to you all about some practical steps and suggestions for how to implement VRpatients into your curriculum. So one of the things I kind of wanted to start out with is that there are kind of two aspects to this integration, and the way that you're going to start employing VRpatients into your classes and into your simulation programs. And so I think if I were going to give you one takeaway from today, it would be start small. Don't get too grandiose with how you're planning on and implementing things. We all know how easy it is to really want to absolutely go big and really use the technology, and it's okay to start small, and I'm going to give you some suggestions for how you might do that today. So it's important to start out having champions. We know that you're here, so clearly you would be very of that type of personality. You want to adopt new technology, work smarter, not harder. And so, I think having people who are those sorts of personality types, who are agents of change, who are agents of promoting new and better ways of doing things, are really important. So, starting with the faculty considerations is kind of how I'm going to start with things. And so I am really going to promote, kind of this sort of backwards approach to integration, which is, what is your goal? What is your intention? Why are you considering VR? What are you hoping to gain? And then going from that, and then going backwards and deciding how to implement it, where you're going to put it into your program, and how you're going to sort of start getting the students accustomed to using it. Um, we know that VR is very evidence-based, virtual simulation. I'm going to give you guys a couple definitions as I talk about things. When we talk about virtual simulation, in the literature, you'll find that people talk about that including both screen-based or 2D type simulations, as well as virtual reality simulation. And so, there are differences. So as you're like looking into literature about it, and if you need to find data to support your program, just be aware that that is um, something that you'll see in the literature. We do know that virtual reality and virtual simulation have been shown to be very effective. Learners train faster and report higher confidence. We've got lots of data from you, our customers, our partners, that you are able to get your students up to speed much more quickly and much more effectively using virtual reality and virtual simulation. So when we're talking about getting ready to implement virtual reality, which most of you already are, but maybe you're not quite up to the level that you'd like to be in how you're using your virtual reality or VRpatients in your curriculum, I like to sort of really start to break it down just to sort of the basic building blocks. And so one of the key factors is going to be your operational considerations. So this might be something to look at in an improvement plan. What are your learning objectives? What are your competencies that you're trying to achieve? Who do you want to be doing scenario building? Are your folks up to speed, or do you maybe need a little bit more training for your faculty? Do they need a little bit more orientation? How are you engaging your students? It's a good idea to really start thinking about those, the operational aspects of, where do you keep your equipment? Who's taking care of it? Are you using best practices? There's more and more uh, products out there that you can use to help you. I know I've seen some customers using different charging carts and charging stations and things like that. So, these are things that are really fantastic. Um, to start considering or look at what other folks are doing out there using virtual reality. They have, I've seen an educational center that came up with this process of marking the headsets and which headset match which controllers and that sort of thing. Really identifying any technical or IT support needs that you might have. Are there barriers? Are there things that are challenging you in the use of using VR in your classroom, not just in the simulation lab? And then thinking about what are you using to collect your data, how are you collecting that outcome tracking, and making sure that you have feedback loops. Every process can likely be improved in some form or fashion, so how are you keeping track of that? um, Making sure that you have ways to keep track of that and to work on making things better. Then I would say, in addition to those operational considerations, when I think about those curricular considerations, are these aligning with your learning outcomes? Are you using a competency-based educational approach? I know that is becoming really all the rage. In about 2021, the AACN came out with nursing and suggested that we need to move towards a competency-based education approach. And I'm going to talk some more about that in a few slides. How can you use VR to scaffold your learning experiences? How can you sort of, again, start small and work your way up so that your students are more able to become familiar with the technology? How are they able to use that technology then to develop their critical thinking, clinical judgment, clinical reasoning skills? Keeping in mind that, virtual reality, there's a lot of flexibility. You could use it across a wide variety of courses, a wide variety of topic areas. You can use it as a practice before an actual high fidelity mannequin based sim. You could use it in replacement for some topics might be appropriate to replace virtual reality simulation with using that to replace your mannequin based sim. Do you want to use it as a more formative type of a learning activity versus a more summative, a more assessment of actual learning that has taken place? Um, how do you want to do your debriefing and reflection? Are there, smaller activities where you might be able to allow students to do some sort of individual reflection on an activity versus do you want to bring everyone together and do an actual true simulation type group debriefing? Um, and then there's always, continuous improvement. What things are working for you in your curriculum, what things are not. We really want to advocate and help you come up with ways to use your VRpatients simulations across and in a wide variety of ways in your courses, across your curriculum, so that it's not only taking place in the sim lab 3 or 4 times a semester, which is what happens a lot of times, unfortunately, with our mannequin-based sims. So when it comes to competency-based education, the focus really has sort of shifted, and this seems to be a trend that is occurring across healthcare education. We all know that we want to improve patient care. We want to improve patient outcomes. We want to make sure that our students, our learners are coming out of our programs ready for practice, that they are able to hit the ground running. And we know that more so in nursing, I would say that hasn't always been the case. That what we're seeing is, there's a true need for, once students graduate, they're trained to be, a generalist, but they come out not quite ready to jump into practice and take things on their own. So we really want um, to really encourage students to develop some of those skills over the course of their education so that they're more prepared. Some things that are important in competency-based style education is that we want to have things be a progression of mastery of these competencies across time, across the whole curriculum. It's a more learner-focused approach. Um, So simulation is really taking a much larger role in these types of programs and this type of educational modality. Now, I would like to say, I do think that some of this competency-based education uh, rewording is really just you're kind of taking some of the same ideas and the same um, techniques that we've had in mind, but we're kind of rebranding it in a way. It's not anything that we don't already know, but I think it's bringing back a little bit earlier in the program and a little bit more focus on developing some of those higher order uh, skills, those higher Bloom's taxonomy. So, in using simulation with competency-based education in nursing, we're going to see that emphasis is really critical thinking, clinical judgment, um, processing those sorts of cues and clues to come to the right sort of decisions. In the paramedic and EMS world, we're seeing those high pressure, quick response, building those skills to rapidly assess a scene and understand what are the appropriate interventions, how to prioritize. Those are the sorts of things. We're seeing that the accrediting bodies in both nursing and EMS are encouraging the use of these kinds of working these sorts of concepts into our curricula as we're training students. Um, and so VR simulation and virtual simulation really have a big important role in this. So when we're talking about competency-based education or looking at competency as a way of training people and keeping people competent as they finish and they're out in practice, and we're doing kind of continuing education uh, activities. The idea is this sort of backwards design. So we really believe that VRpatients is particularly good at this because it really is such a supporting way and a fantastic way to work on those clinical judgment decision making skills. It's learner focused, it's not content focused. And so the idea is, that you start with what it is that your learning goals are, and then you're going to plan how you're going to get to those goals. So it's um, very backwards focused. This is just, I know you all are very familiar with the idea of Bloom's taxonomy, but we're talking about learner centered, not content centered. We know that there's been a lot of content bloat in healthcare education. We all feel like we have to cram so much stuff into our students' brains, and that is that can be kind of challenging. So when you have a more learner centered, it's more putting more onus a little bit more back on our students. We're going to have those learners be responsible for, they need to understand the basics. Our job is to help them learn how to teach up to those higher levels. So again, I'm going to encourage you to develop ways of teaching using VRpatients that are going to be very, we start at the very basics, start small, work on those lower level base of that Bloom's taxonomy pyramid, working at trying to get those initial, just let them practice things at different levels rather than throw them into the deep end of the pool. So this is just a quick overview. I just like to review kind of some of the theoretical background. So this is based on the clinical judgment model from the National Council of State Boards of Nursing. And this is kind of where the idea of that clinical competency-based education, clinical judgment focus sort of starts. And so, we start out over here, with what is the first thing we want our students to do? Well, we want them to start out figuring out what is the most important thing? What are the cues? Is this patient having low blood pressure because they're exsanguinating and they're bleeding out? Or, are they dehydrated? Are they, what are the reasons? What are the cues that start to help us think about, oh, I'm noticing that this is happening, this is going on. And then just practicing that. What is normal? What is abnormal? We all teach this way. I'm not telling you something that you don't already do, but I'm encouraging you to consider ways that you can use your VR patients scenarios and VR patients content and the things that you're building and you're creating for your students to really start that sort of teaching up. And then they're going to start pulling in the analyzing. Okay, well, so now I recognize that something is abnormal. Now, what does that mean? What am I supposed to do with that? Is that something that I can treat? Is that what's within the scope of my practice? What can I do or do not do in those situations? And then prioritizing your hypotheses, generating solutions, and then learning how to do that, taking action and evaluate outcomes. You can develop and create. VR Patients is a fantastic tool. You build your own content, you develop your own scenarios where you can start with a very simple scenario where you have your students, all they have to do is recognize a cue. They can do this repeatedly and frequently so that they get familiar with the technology, where all they're doing is just a little bit of that focusing. We're not even asking them to go beyond that, just recognizing some of those cues. And then a few weeks later, now we can start to analyzing that. A few weeks later, now we can have scenarios that are a little bit more complex, a little bit more uh, further down along the line of the patient treatment path. And now they're going to prioritize those hypotheses and generate solutions. And then finally, once they're a little bit further along in their curriculum or they're a little bit further along in their program, they can start doing full end-to-end simulations. So when it comes to curriculum scaffolding or stepwise integration, I would encourage uh, to look at this both as a kind of a combination of the faculty piece as well as the student piece. So, early on, you're going to think about, well, what kinds of, getting the tutorials, letting them get in there and explore functionality, maybe do some casting in the classroom to allow them, your students, to kind of see what things look like, to explore how do I find what this piece of information is. And then moving on to basic assessment and decision-making skills, that recognizing this is how I'm going to assess my patient. These are the things that are normal. These are the things that are abnormal. And then moving kind of up until they're at the higher level where they're doing like a full-on stimulation that's a full clinical scenario. So now I'm going to change a little bit and talk more about fostering student competence and confidence using VR. So before I go too much further, I just want to remind everyone, we've recently sent out an email. You should have received it. If you haven't, by all means, reach out to your account rep or reach out to our customer support. You would have received an email that asked you to choose, and if you're interested in having some activities. So I'm going to talk a little bit about those activities as we keep going. And so one of the things that we've really worked on is this idea of how to scaffold, how to both help students become confident and competent with the content and also with the technology. So our goal is to have maybe some small activities that are really sort of open-ended playgrounds or very simple 1 or 2 uh, objective simulations that a student could go in. All they have to do, for example, is go in and it's a bit of a tutorialized playground to listen to lung sounds. And it's got some information about what those different lung sounds are and what they mean clinically to allow students, they can pick and listen. They could spend 2 hours in there listening to lung sounds. Not that most of us probably want to spend 2 hours doing that, but they could do that if they wanted to. They could go in and you could assign those activities and students could repeat them until they feel confident, like, oh, I think I can tell the difference between, coarse and fine, um, rales and rhonchi, and allow them to really develop their clinical skills.
Hey,
We go ahead. Go ahead,
hey,
Devin.
Martha.
Yes.
We had question that, or not a question, an example that came into the meeting chat,
Oh, awesome.
and I
Yes.
wanted to also take this opportunity to pause and see if anyone had any questions on kind of everything that you've been bringing to the table today and all this wonderful knowledge. We'll start. I'm just going to read. So Patrick gave an example of one of the sims that he's built or his team has built, a short simulation that taught a fentanyl protocol update and had learners go through the steps in VR. They looked at the protocol compliance and documentation over the next 4 months. And between the test group that did VR simulation and those who didn't, they saw a 15% improvement with the VR group, which is
Oh,
awesome. I think my favorite thing about that is that it speaks to exactly what Martha was talking about before, which is choose a problem that you want to solve and attack it. And that's exactly what that seems like Patrick has done. Is he's like, we're going to try to solve for this problem and do an improvement somewhere, and we're going to build a sim for it. So well done, awesome, Patrick. And if anyone else has any other examples, drop them into the chat. And any questions? What do you think about that, Martha? Patrick building away. I know he's been building for a while.
I think that's fantastic. I think, and I love that it was a short simulation where really the main goal was just to familiarize students and help them learn, help the learners understand the changes in a protocol. I think that is an absolute, exactly what I'm talking about. Ideal situation. You have a goal in mind. You're not trying to make it super complicated, but it's something that's small and measurable and you can see a huge improvement in 4 months. That is fantastic.
Well, I didn't see any other questions come in, so we'll definitely continue. And I want to highlight one more time these free sim activities that were built by our subject matter experts. So you should have received an email on October 25th. And just make sure you check it, check your spam, because you pick the ones that you want, and we are going to move them into your org for free. And they're going to be useful on day one. They are, no stakes, practical, practicing frequently, and sim often. All right, Martha, back to you.
Awesome. Thanks so much, Devin. This is exactly the kind of thing that I think you will find useful. And what I'm hoping, and we're all hoping, is that these sorts of activities will be really ideal for you to start with and might make building a little bit more manageable. If you see how we've built some of these smaller simulations, these activities where all you do is go in and do a treatment, one treatment. If you've got a patient having an asthma attack, all you have to do is the student has to go in and do a treatment. You can use those kinds of scenarios in a wide variety of ways. You can use them in your didactic setting, group discussions. You could have gamification. You could have competitions. These are things that you could assign to students and let them just practice whenever they want at home, because it's going to be the same scenario in VR and versus in on the web-based WebGL. Nick's asking about when the email was sent. I believe it was sent last week, Devin. Does that sound right?
Yep, I'll take care of it right there in the chat
Okay,
on October 25th. You continue.
fantastic. Well, we'll make sure before we're done that we get that out to you if you all are not finding it. Um, so another thing you can use these sorts of activities for as a ticket to ride before they come in to do a clinical, before they come in to do a high fidelity simulation. It will allow that sort of flexibility and accessibility. Whoops, sorry, I didn't mean to do that. I was trying to go down my notes. And so you can help them start to sort of really work at gaining confidence and competence in the technology, not just the content, because that's really important. The more we build our students' knowledge and our learners' knowledge, uh, between how to use the technology, then you'll know for sure, are you actually teaching them, the things that you intend to teach them? Are your learning objectives being met? Or are you measuring, if you leap directly into that expert level, VR experience, expert level, high fidelity type of really complex medical case, then you start wondering, well, am I teaching the students, this content? Am I testing their knowledge of that? Or am I testing their knowledge of that they know how to use VR or that they know how to use the WebGL version of that application? I just like to, again, throw a little theoretical plug, right? This is mostly used in nursing, the Spenner stages of clinical competence, but I would argue that our students go through a slightly smaller version of this, right? We start out with our students, they have zero professional experience. I'm talking mostly people who are either starting into nursing school or starting into a paramedic education. But I would even say too, if you're orienting people, if you're working on the outside of the educational world where you have people coming in to your organization, you're orienting them, you're using this as part of your clinical continuing education program, you're going to still want to stair step them up. You wouldn't expect someone to come in and know everything from the beginning. So, um, again, here's just some more overview slide. Kind of, we know that at the beginning, everyone's learning kind of just basic anatomy and physiology and basic assessment skills. And then they're going to be eventually moving up to that point where they're preparing for entry into practice. Maybe they're preparing for their licensure registry exam. They're learning how to take care of more complex patients, more complex uh, medical scenarios. So, we've got content, we've got these activities. So, maybe start out with just allowing them to practice listening to heart and lung sounds, learning how to navigate the technology. How do I even find out what vital signs are? How do I take vital signs? And get the results that I need to find. Where do I go in VRpatients to look for my lab results or my EKG or my 12 lead? And then eventually moving up to those more complex clinical judgment. So this is again kind of a practical example of ways that you can build scenarios. And some of these are those activities that are going to be on that list of that email. So, just taking vital signs, just listening to lung sounds, um, having a simple single respiratory distress, single objective. The only thing they need to do in the scenario is to do a treatment and look for the patient to improve. And then maybe you build a scenario, you take that one and you edit it, and now you add in that, now it doesn't matter the patient gave the correct treatment, but they still are going to deteriorate anyway, or they've given them the wrong treatment and they deteriorate. So again, it's a way to use those scenarios to really sort of help you build and grow. So, kind of the key takeaways that I wanted to really hit on today is, I would like you to think about, like, what are the goals? What are the goals of your program altogether? Your simulation program, your virtual reality program. What are your desired outcomes? How can you use that VR simulation, whether it's an activity or it's a end-to-end scenario, like a true high fidelity simulation? How are you using those to support the specific competencies that you're trying to get your students to learn? Is it student centered? Is it competency based education? Are you just trying to give them additional opportunities to practice, to have more of a chance to do, every day is a simulation day? We want the ends to justify, or the means to justify the end, I guess is what I'm trying to say. How are you coming up with those? Um, Again, I want you to think about integrating things gradually, using a scaffolded approach. Begin with more of those sort of introductory tutorials, and then slowly build up to more complex, higher fidelity type scenarios. You want to build your students' confidence and competence in both the technology and in their skills and their confidence in their clinical judgment knowledge, so that you're always moving up. I would encourage you to embed virtual reality and virtual simulation across settings. Incorporate it into a wide variety of areas, not only just in the sim lab, but find ways to have it in the classroom, have them do it at home. Have some open lab days where you allow students to come in and practice, whether it's on a screen-based simulation or if it's in the headset. uh, we want to help you and support you to create the most flexible, immersive learning experiences that reinforce the things that your students need to learn. And, as our technology and as our product evolves and gets better, I'm sure you all have seen how much change has happened in the last few years, even in virtual reality simulation. We have spatial mixed reality now. We have lots of different ways of incorporating psychomotor skills in new and different ways that are going to continue to evolve. Um, so, try to come up with novel ways and share them with us. We're working on getting a community forum set up where you'll be able to share those kinds of knowledge and those kinds of learnings that you have had as educators with other educators. We've got all kinds of things on our roadmap coming up, exciting things that are going to make your life so much better. I see Nick has thrown one into the.
He's
Would you
asking a
like to
good
take that
question.
one, Devin?
Certainly. So, your question is, can AI integrate with VR patients to develop patient scenarios or interact with students, etc.? So, I think that's a super loaded question. So, the answer is, can it? Yes. Will it? One day, not today. And there's a lot of building and infrastructure behind that. But our next release is going to be a very exciting one. So don't hold your breath, Nick. Don't worry. We've got our finger on the pulse of AI. And in not too many months, there's going to be a nice update that is going to be substantial. And you guys will all have, hopefully, you all feel a much easier building process, creation process, and a more natural engagement with your patient avatars.
Yes. Stay tuned. Stay tuned. Uh, I think, the majority of us, I think, are pretty comfortable and pretty familiar with the use of VR as a simulation modality that's kind of similar along the same lines as high fidelity mannequin sim. And
You know,
we say, yes, absolutely do that. You want to add?
no, yeah, it's
Uh,
Nick.
oh
He
yeah,
said that
Nick using it for
he's
scenario
been using
development.
AI for scenario development. So I don't know if you
Yeah.
have an anecdote about this one, Martha, but the idea that you can use even just ChatGPT, the free version, but use AI to draft your
Mhm.
script, your scenario script with the dialogue with the patients after you've created a scenario with it. Have you had any experiences or toyed around with that, Martha?
Absolutely. So I went to an educators conference this summer, and this is really being starting to really gain a lot of traction. Educators are using it they'll put a prompt into ChatGPT or another AI engine, and they'll write a lot of scenarios. And so it's super exciting to see educators getting creative with learning how to do prompt writing, learning how to hone in on scenario development, challenges. I think most of us are pretty comfortable creating like a basic scenario, but then maybe, you're all busy. You have many, many students, you have many competing uh, parts of your job that are, take your time and energy. So sometimes coming up with that dialogue of, what does the patient say back when I ask them this question? Um, and yeah, the newest version, Nick just put another paramedic program is using GPT 4.0 to have a verbal conversation between the student and the AI. Yeah, there's a verbal component now, right, Devin, that you can use to actually speak
Yeah, so
between.
yeah, we built one a couple of months ago. We've just been using it internally, but effectively, you can create a prompt, and you can build a GPT actually in 4.0 if you have Plus that tells the AI to act a certain way and kind of stay on rails, and then you kind of deploy it, you
Yep.
publish the GPT, and then you use it on your phone and you hit the microphone and you can just have a conversation with it. It's pretty cool. Sometimes it likes to try to pretend that it's the provider, and you have to remind it, no, you're the patient, I'm the provider. Uh, but it is really fascinating where the technology is heading. And as
Yeah.
we, VR Patients, as a technology company, engage with this technology, we have some really core principles that we have to make sure that the technology meets before we deploy it to you guys at scale. That is, has to be secure, has to be on
Mhm.
rails, controllable, accurate. It can't just be a hat, like you're just putting an AI in a hat and all of a sudden you can change the hair on your AI because it creates the image. That's not what we're aiming for here. Everything we do at VR Patients is fully integrated, needs to remain editable and customizable by you guys. So, again, in short order, when you guys receive our next major update in the next few months, and don't worry, we'll warn you, we'll let you know when it's coming. Um, we're hoping to put more power on your tool belt than you've ever had before, and that's going to be an architectural and infrastructural upgrade. Now that we're kind of
Yeah.
we're kind of winding down a little bit, I think we should have a little bit of an open discussion because we've got a little bit of
Yeah.
time left, another 10 or
Mhm.
15 minutes. And I would like to ask you a question, Martha, that kind of goes back to what Patrick was talking about, which is 15% improvement. Um,
Mhm.
and so I want to ask you, what evidence or what metrics should programs attempt to track? Like, can you give any examples of,
Mm.
some people call it a KPI, a key performance
Mhm.
indicator. Um, what should they target? What would be a good target that would show the impact of VR on, say, critical outcomes or readiness or maybe real world practice or clinical judgment? Can you think of any that would be some great starting points? They don't have to be the big, difficult ones.
Oh, yeah, absolutely. So some folks that I've seen, if they're looking at that confidence and competence uh, aspect, it could just be as simple as measuring students' confidence. Like, how do you feel after doing this scenario? Do you feel that you are more prepared, that you're more confident in your ability now that you've gone through this scenario to care for this type of patient or this clinical situation? Do you feel, you know, less concerned, frightened, of talking to a patient about their, uh, one of those challenging, crucial conversations. I know, having taught nursing students, and I have taught in a lot of OB classes, a lot of students are really freaked out by the idea of the level of, intimacy of a birth experience and talking to patients about their sexual health history and things like that. So to be able to ask them, okay, now that you've done this scenario in VRpatients where you've done a full patient history and you've asked them about those, personal and private types of things, do you feel more confident in your ability to do that? Other things you could look at, test scores. Are your students improving on their test scores after they've done maybe some of these activities? Have they been able to improve their score in medication administration and selecting the correct medication? You could look at their scores in the actual scenario. Did they improve? Were they faster at getting the treatment achieved or coming to the correct conclusion for the scenario that treatment requires? Those are, all pretty simple, pretty low hanging fruit that you could build
Mhm.
into your assessment.
I can give you another example. So, Portland Community
Sure.
College is measuring the time to competency, or maybe it's not. I think it's more specifically time to team lead. And
Mhm.
so, many of you may have your students, as soon as they graduate, basically get hired. We all know there's a shortage on the front line on all aspects of healthcare. So, there's a good chance that your students, hopefully, are walking right into work and are more competent on day one. And so what Portland Community College was measuring was the students who performed virtual simulation throughout their curriculum. how long did it take for them to no longer be proctored when they were hired, to no longer have that professional over the shoulder? And they were a solo, competent provider. And so they communicated with the agency that hired to find out that the students who did do VR patients in their initial education were becoming solo competent providers 2 to 3 weeks faster. And that
Mhm.
was a big deal for the community, a big deal for the agency. It saved them money because they don't have to tie two people up for one clinical, situation. And that's a really great, impactful metric for you as educators to provide to your deans and your directors to kind of prove out this ROI that, frequent simulations and failing often, failing fast, or real life training without real life consequences and allowing people to operate in a summative environment, and maybe you sprinkle in some formative simulations, can really have a high impact. And I would say another low hanging fruit that kind of speaks to what Martha was talking about earlier around activities is, you could really just, one of the activities in the list that we've sent in the link, if you didn't already fill it out, is listening to lung sounds? And that's a great question, Dustin. We'll hit that in just a sec. So let's say you're working on lung sound identification, like rhonchi versus stridor versus wheezes, and students get tested on that certainly early in their curriculum as well. And it's kind of a skill you have to continue to massage. I mean, one of the activity sims that we provide you guys in that list is all the lung sounds and little quizzing within it, and it's all summative, and it's just iterative practice, and they're real people's lung sounds in all fields, and it just keeps changing and cycling. It's like a 10-minute sim. You could measure that. You could literally measure their ability to identify a physiologic issue with the patient because you've created a sim focused solely on that single learning objective. Identify the heart tone, identify the lung sound, or something like that. Now, metrics for veteran providers. Do you have any thoughts here, Martha?
I think you could for sure look at time. You could look at speed. You could look at those critical thinking skills in terms of, I know, we've talked about with some of our folks that are training people that are actually working practitioners in the field, and maybe there's a deficiency, or we're finding it's taking too long to come to the correct conclusion for um, a certain type of clinical situation. You could use that as a quality improvement project to see, what are we missing? What are you might be able to identify some deficiencies. People are focusing on the wrong thing. We might need to put you could build different sort of distractions in to help your providers that are,
Mm-hmm.
that are currently in practice, to help them, focus on that, coming to those right conclusions, picking the correct pathway to go down for their treatment or their, what they're
Well
considering
done.
prioritizing.
Thank you for the clarification, Dustin. I asked him if he meant like military veterans, which I would suggest a mental health scenario would be very powerful. And then but you're talking professionals. I'm an 8-year medic, and we got a couple people in the background here who are seasoned pros, and I would suggest that you lean towards those high acuity, low occurrence
Yeah.
simulations. A quick example of that, I was very lucky when I was going through seasoned. Yeah, the salt and peppered in the group. Um, when I was going through my clinical education and rotations and whatnot, I was lucky to get my 2 pregnancy contacts very quickly. But I think we all learn that it's really not about baby, right? When baby comes out, if they're screaming, they're breathing. How's mama? And we're gonna turn baby into a burrito and get them in, and they're gonna probably be okay unless it's a very unique circumstance. But there is an opportunity to train in VR patients on these ensanguinating mothers, these pregnant mothers, because you can do abdominal distension and do a whole shock scenario. Epileptic seizure. You could do, the high blood pressure situation, and you could do these types of sims that really in real life you don't come across frequently, and maybe there's a particular protocol that you do locally with this patient population, or maybe you have high morbidity rates in a particular population locally, and so that is actually what you're going to build and train on is, locally we have this issue statewide or citywide, so I'm going to build on that sim. and try to solve to that problem. I really think that's what it's about for professionals. I don't know what your opinion is here, Martha, but you know, you guys already have your license and you guys are killing it, and not killing it. You're doing great. You're saving it. You're killing the game. But that doesn't mean that there are things that we don't see frequently, and suddenly, you know, in an emergency, you're 50% as effective as you are in real life, you know, when you've practiced. So you really want to practice frequently. It's not about getting a grade, right? It's about
Yeah.
iterating on it. What are your thoughts on the old dogs?
Oh yeah, I totally agree. I think it's sort of the idea when RQI came around, for example, where we learned that doing your BLS recertification, especially for providers in the hospital on the units who maybe aren't doing CPR on some of those units. So having some kind of refresher more frequently will help keep your skills up. We know there's about a 12-week decay in skills. So yeah, to be able to do those high acuity, low frequency events is a fantastic use for it. Um, like I said, if there's a certain area that people are feeling like, I feel like I haven't seen insert some kind of case here in a long time. Like, it would be fantastic use to have the opportunity to practice that more frequently.
I do have one thing that will probably be of value here. It's a little bit more tangible. If you guys don't already know, the NREMT is doing a continued competency initiative. This is EMS focused, folks, just because it came from an EMS customer. Um, they are working on continued competency initiative on their CEs, and so I would encourage you to read this little article they published. It's very high level, but what they're talking about are their oh gosh, what's it called? Evidence-based practices. And they've published, the NRMT has published and prepaid for lots, like thousands of evidence-based practices. And so I would encourage you to Google or look up the NREMT's evidence-based practices and consider downloading some of those and building a sim based on that. Because guess what? You're going to have to recertify on that stuff for the old season old dogs.
uh, all right, you want
Are
to
there any advanced skills? Yeah, thank you, Dustin. Are there any advanced skills that can be added to the scenarios as a procedure or intervention, such as intubation, surgical needle crike, chest tubes? This is a phenomenal question. I've got some thoughts here, but I'll let you tackle it first, Martha.
We have a lot of those on our roadmap and are working towards adding those in. I think I have a suspicion for what Devin might be going to say, so I will try
Yeah.
to veer away from that. Uh, but yeah, we have a lot of our folks that are using it in the paramedic and EMS world that are using it as like being in the headset and then doing part of it in the headset and then getting out of the headset and doing them on a mannequin.
Mhm.
And so I think is that probably where
Yes.
Devin's going to go with it. I will let
This is
Devin
where I'm
go.
going to do my thing. So, Dustin, this will never make me better at IVs. And if you come to my house to give me CPR and you've only ever done CPR like this, or you've only ever intubated like this, or even hand tracking, and you're touching air, I would prefer that Patrick intubate me because he breaks ribs, and I want the guy or the girl who practices on real task trainer stuff for those type of psychomotor skills. Now, there are decisions that can be made, clinical decisions around intubation, why intubate, what size tube, when to intubate, but that actual physical skill, the needle crike, I totally get it. I totally understand. Those types of maybe low occurrence situations, certainly the crike, are scary. But you really want to practice those in a way that's going to make you better at them, and you're going to feel the pressure and the push and the pop and the all the depression. And so there are certain things that we're going to make sure that we don't want to waste your time in virtual sim with something you're going to have to relearn in real life. So some of those items like surgical stuff we're probably never going to actually do full on. Now that doesn't mean that you cannot do, like Martha said, a really cool mixed reality simulation. And what could that look like? We did a couple of examples with this where and we just talked about like medication rights or medication administration. It was really proving a point. It was you're talking to a patient, you're assessing them, you're working with them, you're trying to treat them. You have a standard protocol or an order, and you got to give some medication. Now, there is a practical skill to drawing up the med, to puncturing the little guy, to spiking a bag that you can't really mimic digitally. We want you to be able to do those things, but still stay in flow with your simulation. So you have to go back and continue to assess and actually give the med in the digital sim and see their physiologic response, and then have to deal with that. Maybe they're allergic to it and they start seizing. So we want you to be able to keep your headset on, turn to a task trainer, perform a skill. I would recommend, if you're going to deal with blades and really sharp objects, to perhaps do those not with a headset on, just because of like depth perception. But there are many other skills that you could do: suctioning, draining, like bags, or even catheterization. There's a number of skills you could do that don't involve cutting skin. That would be highly valuable to do in flow in your sim without taking your headset off and accomplishing a psychomotor skill. I see. Yeah, visual aids. There's actually something that we could be done there. I don't know if you want to speak to it, Martha, about uploading imagery in the media tab.
Mm-hmm. Yeah, so you can always do that. If you want to, to show uh, perhaps an IV that is infiltrating or extravasating, something like that, you could put a picture and add that into the chart. Um, there are, some different ways you can handle that. Um, but to your point, Dustin, yes, there are always, the sort of props, so to speak, or things that, to show you, oh, you inserted the Foley catheter. Now you see in the virtual patient that there is a Foley catheter. We have a bunch of those that we're working on adding in as needed. For sure. So, but if you have things like that you feel like are really limiting your educational, or things that you'd really like to see, things that you're like, oh, my God, it would be fantastic if you just had a blank, just by all means, shoot us a line, please. By all means, shoot us a line, because the more feedback we get from customers, the better.
Uh,
I'm just going to, oh, go ahead, Devin.
I was just going to say, especially if you have an idea and you want to build something and you don't know what's possible with the existing tool set, reach out. We'd be happy to help you scope something out to, like, can this be created without having to develop anything new? You have an idea. How can we do it with the technology set today?
Yeah, we have a great group of subject matter experts who are extremely creative and know the platform beautifully, so in depth, and we can come up a lot of times with some really remarkable ways of adding things in. I just had a couple more slides. Ultimately what we were trying, I wanted to kind of close with is, we want the focus to be on what it is that your learners are learning, not on the technology. So, in an ideal world, the simulation technology, Devin's talked about this before, it should kind of melt away. We want it to feel as immersive and real and close to how things really are. So the more your students use the technology, the more ways and the different creative things that you come up with to add this into your to your educational program, to your courses, the better. So I'm gonna just kind of do I got some references, and what other questions? Yes, we're definitely have wound
Yeah.
care on the roadmap, definitely.
And the monitor thing, God, you guys are right on it.
Yes.
For the last minute, I'd like to show, oh, here's her references. Take a second, screenshot the references if you want. And
Here.
then I would like to show you something as well as we close out. Just to get you all excited, I just got notification from Tom Shoemaker, who I'm sure that you guys have all also met. Awesome member of our team. Are your activities, if you filled out the form, refresh your org. Your activities are in your org today, right now. They look like this. So here's activity heart sounds, activity lung sounds. So what I'm going to do is I'm going to open up one and I'm going to show you what it looks like. I'm going to hit run. Right now, it's going to load pretty darn quick because there's not a ton of logic in it. Again, this was created by our subject matter experts and Martha's team and Tom Shoemaker's team. And here's what you've got. We have a learning scenario. I think I messed around with the avatar and the location on this when I was showing it off. All your goal here is to activate lung sounds, but let me show you how it works. It's really cool. This is what we're aiming for. Ready on day one. Use it with your students today. Oh yeah, she's all beat up because I
Welcome
was
to the
practicing
Lung
with Moulage.
Sounds Sandbox. This scenario will allow you to change the patient's lung sounds and auscultate them using the stethoscope. To hear this again, click Repeat Instructions in the dialog menu under Narrator.
Okay, sorry she's all beaten up. I was showing something off. So I'm going to turn on closed captions. You have a narrator. This is fully tutorialized. I'm going to go to Assess, and you can see there's a new button called Lung Sounds. When I select the lung sound, watch what happens. So I'm going to go to Wheezes Low.
Wheeze low airflow. Wheezes with low airflow are quieter and less continuous due to reduced airflow, which may occur in severe asthma attacks or other obstructive airway diseases.
So you select it. It then changes the lung sounds. It triggers the lung sounds to change. It defines them. You can go into your diagnostic tools and listen, and now you've got wheezes in all fields. And so if I go back in and I go again, and I'm going to go to crackles,
Crackles coarse. Coarse crackles are low-pitched,
I get a definition.
wet, bubbling sounds
The lung
that
sounds
occur
have
when
now
air
changed,
passes through
and I
fluid
can listen
or
to crackles.
secretions in
And
the
I've got
larger
15 minutes to
airways.
play around with
They
all
are
the lung
often
sounds
heard
in all
during
fields and
inspiration
practice.
and can indicate conditions.
You guys have the opportunity to select from, I think it's 8 or 9 activities, including a medication math activity to help you practice med math. So please go in and check it out and let us know what you think. Send us your thoughts on those, and if you have requests on activities, send them your way. Send them our way. Oh, and by the way,
Yes.
they're super easy to copy out of and duplicate, so do that.
And that's what we got.
Uh, Everyone, thank you so much for your time and attention. I want to give the last word to Martha. Thank you, Martha, so much for being here today. Any final thoughts before we end the webinar?
No, I just mostly want to say we're so glad you came. We really want to do everything we can to support you. I know you're out there doing really important stuff, supporting our frontline first responders and healthcare professionals, and we really appreciate you and want to do everything we can to support your work.
With that, everyone, have a great rest of your day, and we'll see you at the next webinar.
Thanks.
I'm going to stay on to the last man or woman in case there's one of those questions where
Absolutely.
no one wanted to say it in front of the
Burning
group.
questions. Yes.
Yeah.
I didn't want to be the only one.
Yeah. Thumbs up, Jay.
You had a nice turnout. I'm so glad.
Yeah, absolutely. All right, there's only a few left. Connor's on our team. Watson, Comalita, and Angie, if you guys don't have anything, we're going to close it out. Thank you very much.
All right. Bye-bye.